The Villages looks like retirement paradise, America's fastest-growing senior haven, basking in sunshine and no income tax allure. But behind those immaculate lawns, new residents face a reality almost no one discusses: soaring amenity fees, untold bond debts, and monthly costs that quietly spiral beyond what the brochures admit. If the math is breaking here, what does that mean for the rest of America's retirees? Welcome to the Florida retirement trap nobody talks about. Let us peel back the mythology and see what really lands on the monthly statement. Rumors about the Villages have traveled far beyond Florida, with one story in particular refusing to fade: the claim that this community has the highest STD rate in America. That tale took off after a Tampa Bay Times article in 2012, and it has been echoed by national news outlets and social media ever since. When public health officials reviewed the numbers, the reality did not match the headlines. Florida Department of Health data from 2023 shows that Sumter County, home to the Villages, does not even rank in the top 10 for chlamydia, gonorrhea, or syphilis. Miami-Dade, Broward, and Hillsborough counties, all urban and much younger, report far higher rates. The spike in cases that first caught attention a decade ago was not unique to the Villages. It reflected more routine testing among older adults, not a sudden behavioral shift. Epidemiologists and infectious disease experts have called out the media narrative as misleading. They point to the difference between increased screening and actual risk. In fact, the CDC national data confirms Sumter County's rates are average or below for a region its size. The story of the Villages as an outlier is more myth than fact. An example of how a catchy headline can outpace the evidence. With the rumor set aside, what matters most for residents is not the urban legend, but the real costs and challenges that shape daily life. The next reality check comes not from gossip, but from the numbers on every retiree's monthly statement. Every Villages homeowner faces a baseline cost before even thinking about the mortgage or any optional upgrades. The foundation of that cost is the amenity fee, a required monthly charge that covers access to pools, clubs, recreation centers, and the 24-hour neighborhood watch. For 2025, the standard rate is $199 per month, billed directly and indexed to inflation. This clause ties the fee to the Consumer Price Index, so the fee rises each year with inflation, and there is no local board discretion to freeze or reduce it. Residents who bought before 2019 remember when the fee was capped at $155, but that cap is long gone. Today, every new buyer and anyone who has inherited or purchased a resale since 2019 starts at the prevailing rate with automatic annual increases. Alongside the amenity fee comes property tax. In Sumter County, which covers the majority of the Villages, the median annual property tax is $3,834 for 2024. That translates to about $320 per month. This figure assumes a typical home with the standard homestead exemption, though it can vary with property value and precise location. The tax bill arrives with line items for both ad valorem taxes based on the home's assessed value and separate non-ad valorem assessments, but the core tax itself is unavoidable. For a typical couple, these two charges alone, $199 for amenities and $320 for property tax, add up to $519 every month before accounting for any bond assessments, maintenance fees, or insurance. Residents like Michael and Tiffany say these fixed costs are the first numbers they plug into their retirement budget each year, knowing that both will likely edge higher with inflation. The promise of no state income tax in Florida is real, but the recurring monthly outlay for just the basics in the Villages is substantial, and it is locked in from the moment the keys are handed over. Hidden beneath the surface of every property tax bill in the villages sits a line item that surprises many newcomers: the CDD bond assessment. This is not a routine fee for landscaping or pool upkeep. It is repayment for the very roads, sewers, and storm drains that make the neighborhood possible. When a new home is built, the developer issues a community development district bond, often totaling $23,000 to $28,000 per house in the newest phases. Homeowners, not the developer, pay back this bond through special non-ad valorem assessments, spread out over 20 or even 30 years. The charge lands on the tax bill each year, separate from property taxes, and cannot be negotiated away. Some residents choose to pay off the bond in a lump sum, but most carry the balance for decades, watching the figure shrink only slowly as interest is paid down. For Michael and Tiffany, the reality of these assessments only hit after their first full year. The couple tracked every expense, tallying not just the amenity fee and property taxes, but also the annual bond payment and the ongoing CDD maintenance assessment, another required charge to keep parks, trails, and recreation centers running. By the time they added homeowners insurance, their monthly ledger had climbed past $1,300, even after the mortgage was gone. The couple described the feeling as sticker shock that never really fades, especially when inflation nudges each line item upward. For many, this stack of costs changes how retirement looks. Fewer spontaneous outings, more careful budgeting, and a constant awareness that the so-called hidden fees are anything but hidden once the checks start clearing. The promise of an affordable paradise runs headlong into the arithmetic of long-term debt and rising maintenance, leaving residents to ask who exactly decides where the money goes and how much more it might cost next year. Every dollar that flows into the village's system, whether from amenity fees or community development district bond assessments, passes through a formal process that looks, on paper, like local government in action. Community development districts are the backbone of this structure. Each district has its own board, with members who are either appointed by the developer or, over time, elected by residents. These boards hold regular public meetings, publish agendas and minutes, and vote on everything from annual budgets to the fine print of fee adjustments. When it comes to the amenity fee, the process is tightly scripted. The increase linked to the Consumer Price Index is not a matter of debate. It is a contractual obligation written into every deed and reinforced by annual board votes. Each December, the relevant board, often the Amenity Authority Committee or the Project-Wide Advisory Committee, receives the latest Consumer Price Index data. Staff present a calculation showing the exact percentage change, and the board votes to approve the new rate. The outcome is nearly always unanimous, since the deed language leaves little room for negotiation. Residents can speak during public comment, but the board's legal counsel typically reminds everyone that the Consumer Price Index clause is binding. The new fee is then announced in newsletters and reflected on January bills. Bond assessments follow a similar path. When a new neighborhood is built, the Community Development District Board authorizes a bond issuance, usually spanning 20 to 30 years. The offering statement spells out the principal, the interest rate, and the per-lot allocation. Each year, the board reviews the debt schedule, votes on the annual non-ad valorem assessment, and submits the figures to the county tax collector. Board minutes detail the math: how much principal remains, how many lots are affected, and what each homeowner will owe on the next tax bill. Residents can request payoff amounts or challenge errors, but the assessment formula itself is locked in by the original bond documents. This quasi-public model mimics municipal government, but operates under a different logic. The developer holds sway in the early years, appointing board members and approving major expenditures. As neighborhoods mature, residents gain more seats, but the framework and financial obligations remain largely fixed. Every fee increase Every bond payment is the result of this process, visible in meeting transcripts, budget spreadsheets, and the annual votes that set the next year's numbers. For anyone trying to follow the money, the paper trail is there, but the levers of control are often out of reach for the average homeowner. 8 years of federal scrutiny brought the village's finances under a microscope. An IRS audit that probed the tax-exempt status of community development district bonds. The inquiry demanded thousands of pages of documents, legal opinions, and board records. Developer attorneys and federal agents traded letters and met for tense negotiations, both sides aware that a penalty could have upended the community's funding model. In the end, the IRS closed the investigation in 2023 without imposing fines or changing the bond structure. Official closure letters cited compliance with federal guidelines, but the process revealed how much legal and political muscle stood behind the village's financial machinery. Oversight at the local level was a different fight. As the audit faded from headlines, longtime residents, some with backgrounds in finance or government, began filing public records requests, seeking detailed breakdowns of amenity fee calculations, reserve fund balances, and contract negotiations with service providers. Activists circulated petitions demanding more transparency from district boards, especially as annual consumer price index-linked fee hikes outpaced many residents' Social Security adjustments. At town hall meetings, homeowners pressed for plain language explanations of how their money was being spent, only to encounter legal cautions and tightly controlled agendas. The village's homeowners' advocates, the largest resident association, often sided with the official line, emphasizing the necessity of fee increases for long-term sustainability. Grassroots groups and independent newsletters kept up the pressure, publishing side-by-side comparisons of board votes and budget allocations. One activist, a retired auditor, called the system public in form, private in practice, pointing to the limited influence residents have over contracts and spending priorities, even as monthly bills climb. Accountability remains the core tension, visible in every committee meeting, every petition, and every unanswered question about whether rising costs are matched by rising value. For many residents, the search for answers has become as much a part of daily life as the amenities themselves. UF Health, the village's hospital, stands as the primary healthcare facility for a community of more than 150,000 residents. The hospital operates with approximately 307 staffed beds, a figure that has remained steady even as the population continues to climb year after year. In response to mounting demand, the area has seen the addition of new emergency resources, including a freestanding emergency room at Brownwood and expanded urgent care centers. These expansions are designed to relieve pressure during peak times, especially flu season and periods of high admissions, but the core capacity remains tightly fixed. During the most recent surge in seasonal illness, reports surfaced of emergency room wait times stretching for hours, and on occasion patients were transferred to hospitals in Ocala or Leesburg when local beds ran out. The hospital's official numbers, published in industry profiles and on Medicare dashboards, confirm the 307-bed figure, a number that has not kept pace with the rate of new home construction or the influx of retirees. As more residents arrive each year, the gap between available beds and potential need continues to widen, making access to timely care a growing concern. While new facilities and urgent care centers offer some relief, the underlying math is hard to ignore. The village's healthcare infrastructure, built for a smaller community, now faces the challenge of serving one of the fastest-growing senior populations in the country. The numbers paint a clear picture. Proximity to care is only part of the equation, and the question of capacity remains unresolved for many residents. Medicare ratings for UF Health, the village's hospital, tell a story that changes year to year. Some seasons, the hospital posts average scores for patient outcomes and staff responsiveness. Other times, ratings dip below state averages. especially during surges in admissions. Residents trade stories about waiting hours in crowded lobbies or being sent to other cities for specialized care. For new arrivals, the promise of nearby healthcare can feel reassuring, but the reality is more complicated. The region's median age continues to rise, and with it the demand for everything from cardiology to physical therapy. National dashboards show that as the population ages, the strain on local resources intensifies. A frontline clinician summed it up in a recent interview. "You can buy proximity, you can't buy capacity." That warning lands hard for retirees who move to the villages expecting seamless access to doctors and hospital beds. The Medicare Care Compare tool compiles patient reviews and clinical data and shows that ratings for the village's hospital fluctuate, reflecting the pressure of serving one of the country's oldest and fastest-growing populations. Residents who need a specialist or rehab bed may wait longer than they planned, especially during flu season or after a hurricane. The local demand curve bends upward every year, and the healthcare system, despite new clinics and emergency rooms, struggles to keep pace. For many, the greatest challenge is not the distance to care, but the real possibility that when they need it most, the system may already be stretched thin. This is the human cost of growth in a retirement destination that keeps getting older and bigger, faster than its critical services can expand. In June 2018, a sudden collapse beneath McLaurin Terrace forced a family out of their home and left a visible scar on the block. The sinkhole was 15 feet wide and 20 feet deep. It cracked foundations and sent engineers racing to stabilize the ground. Pressure grouting and underpinning cost $127,000, with the bill split between insurance, remediation contractors, and the homeowner. Even after repairs, the impact lingered. County records show that properties touched by the incident sold at a 15 to 20% discount compared to similar homes nearby. One listing sat for over 200 days before a buyer stepped forward, and the final contract included a confidentiality clause about the sinkhole history. Central Florida's karst geology means these events are rare but never impossible. State geological surveys document dozens of sinkhole incidents each year across the region, most minor, but a handful severe enough to disrupt lives and finances. FEMA maps offer only a partial picture. Local risk can change with rainfall, old irrigation lines, or shifts in the water table. For retirees on fixed incomes, the risk is not just physical. It is financial. Insurance premiums jump after a claim, and some owners find themselves priced out of coverage altogether. The true cost of paradise, for a few, is measured in remediation bills and lost equity, not just in monthly fees. Listings in the villages that once sold in a matter of days are now sitting for months, sometimes more than half a year, longer. Local realtors point to a new reality. Buyers are hesitating, running the numbers on not just the purchase price, but the ongoing burden of amenity fees, bond balances, and insurance premiums. Data from 2024 shows a growing pool of homes lingering on the market for 180 days or longer, especially those with high remaining bond assessments or steep insurance quotes. One agent summed it up bluntly: your exit price is a function of the next buyer's monthly, not your nostalgia. Sellers who prepaid their bonds or can show lower insurance costs find buyers faster. But those with hefty recurring charges face tough negotiations or price cuts. Deals have fallen through when buyers discover the true monthly nut, or when a policy transfer bumps insurance beyond their budget. In a market where carrying costs keep rising, liquidity is no longer guaranteed. The numbers tell a different story, one where the real trap is not getting in, but getting out. Today, more than 150,000 residents navigate the village's rising costs, shifting risks, and a healthcare system stretched by rapid growth. For America's retirees, the fine print here sets a precedent everywhere. As insurance premiums and amenity fees climb, the real price of paradise becomes impossible to ignore. The promise of sun and security now demands sharper questions and far more honest math.